We are back now with the growing concern around measles, with online searches about the disease soaring 900% in the last week. Our chief medical correspondent, Dr. Tara Narula, is here live to answer some of the most pressing questions. It's great to have you with us, Dr. Narula. Clearly a lot of interest in this with those online searches. Put this outbreak into perspective. How does it compare to the past?
Yeah, perspective is so important. So we were just talking, we do see outbreaks every year. In fact, last year there were about 16 outbreaks, 285 total cases in this country. I think what's concerning here is that we're only 2 months into 2025 and we're already seeing 124 cases in Texas, 3 outbreaks in the country, and multiple states reporting cases. And we've also seen the first death. You know, that we haven't had a death from the measles since 2015, and we haven't had a child die from the measles since 2003. So when we talk about why this might be happening, we know global measles cases are rising, and then we see these pockets in this country of unvaccinated. In order to protect those pockets, we need 95% of the people in the community to be vaccinated. The problem is our community rates of vaccination are about 93%. So we don't have, as we mentioned, that firewall of safety around those unvaccinated groups, and that's where we see this spreading. And unfortunately, there are vulnerable populations, kids, adults over 20, pregnant women, and immunocompromised, who end up potentially being even more at risk in addition to those generally unvaccinated.
And measles is highly contagious.
It is. So when you think about contagious, lots of times we think about the flu and COVID and even scary diseases like Ebola, but this by far and away surpasses that. So for example, George, if I walked into a room with measles and there were 10 people who were unvaccinated, 9 would get the measles. It can live in the air for about 2 hours. In general, if you are exposed, you will develop symptoms anywhere from 7 to 14 days afterwards.
So you could be contagious before you show symptoms?
Absolutely, yeah. So you're contagious 4 days before the rash and up to 4 days after the rash.
Wow. All right, so this is quantifiable, people's interest in it. We know what the search numbers are. So some of the questions that people are looking up, so let's get some answers on them, are can I get measles if I'm vaccinated? And even if I'm vaccinated, can I spread it?
So this is one of the most effective vaccines we have. If you get 2 doses of the MMR vaccine, it's about 97% effective in protecting you. 1 dose, 93% effective. When we think about flu vaccine, for example, we're talking more in the 40 to 60% range. In terms of, if you get vaccinated, can you spread it? There was one case actually reported in the literature back in 2011. They called her Measles Mary, a 22-year-old in New York City who was vaccinated, who did spread it. But, according to the CDC and others, this is very, very unlikely. So if you are fully vaccinated with 2 doses, you are not really likely to spread this to anybody else.
So what's your advice to parents out there who are looking at all of this and thinking about their kids, maybe in daycare or school right now? What should they be doing?
So I think we forget how dangerous measles can be. Before we had a vaccine in the 1960s, 40 to 50,000 people in this country were hospitalized. We saw 400 to 500 deaths. And so it is really important to think about the complications. We know that 1 in 20 kids can get pneumonia from the measles, 1 in 1,000 get encephalitis, which is swelling of the brain, and up to 3 out of 1,000 kids can die. So, really important to get your kids vaccinated with the MMR vaccine. 12 to 15 months is the first dose, 4 to 6 years old is the second dose.
All right, Dr. Narula, as always, thank you.